Um, Thank you for coming back again. This is Angelo Majok, the clinical officer, and is also holding bachelor degree in hospital and early system management. Before we go ahead, the title of the discussion today is the failing healthcare system. Uh, Before we go in detail, allow me to play this track of Dun Lusay, because what we are facing today is financial issues, administrative issues, leadership problem in the healthcare system. So let me play this song. Give us break so that we go for full detail of how does the failing health system look like and what are the characteristics of the failing system. And how are we going to fix it? So let's listen here. After that break, we have to go to our main topic, which is the failing healthcare system. What is the failing healthcare system? A failing healthcare system is a system that is characterized of high costs. For example, if someone is going for treatment, you'll be charged higher. And then we have the poor access. Poor access can be due to distance or no healthcare settings being put in place. And then fragmented care. In actual sense, fragmented care are like the, 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 the staffs themselves who are giving the, the, the health services are not doing it the right way, or quality gaps. There is no quality health care given due to poor trainings and lack of education and employment of workforce that are not right. And then sometimes the other thing, which is characterized in this failing healthcare systems, are like workforce shortage. And this one sometimes can lead to people delaying or skipping care, medical debt, worse health outcome, especially uh, in the countries like South Sudan. So these are the issues. And to go furthermore, what are the indicators of failure in the healthcare system? One of them is affordability and accessibility. If people cannot afford, they are not able to pay for medical bills because it is very expensive, or they do not have enough money to cover, then that is a failure. Other one is accessibility. Maybe the hospital is located in to reach areas. Like for example, if we have emergency into the possibilities of people run to come to a wheel town with a that there's complication like require emergency, example, cesarean section, breech deliveries, and other complications specifically? Or should we have an emergency that require maybe at least 2 hours to do that emergency, and then someone is is far away, is coming from a distance of 3 hours to reach the hospital. So this is what we call accessibility problem, because people will fail. So I cause sometimes force many people to skip needed care. For example, you need a medication that costs $10, assume, or 50,000, and you don't even have that amount of money, so you have to skip it. You can skip prescription, the medication that are prescribed by medical doctor or any healthcare personnel, and sometimes you face debt. You fall into debt because you have to choose between borrowing and dying. And in such situation, you have to borrow, such that you fall into debt. So this is one of the indicators. So affordability and accessibility are some of the indicators of failure. The other indicator of failure is the coordination issues, meaning that the communications, how the system should work, is not in the right manner. Uh, for example, a care fragmented across providers. Maybe the hospital has no proper communication with the institution like the health ministry, and the health ministry has no proper communication with the institution that fund the health, like Ministry of Finance and other health providers. This can lead to complications or poor coordination issues in the health, and also errors can happen at the same time. This is one of the indicator, we mean a forward for coordination. And the other failure issue here is what we call quality and outcomes. So when we talk of quality, it is a standard that is supposed to be provided. So sometimes we have to differentiate the difference between quantity and quality. Quality is a standard, okay, and outcome. So what you give and what are the results. For example, if you have 10 patients and you you happen to treat them, therefore we will see the quality you are provided. For example, if all of them recover, we will realize that the hospital has the right personnel, because out of the patient coming to the hospital, 100% of them get treated. And for example, if you have 10 people, then they come to your facility, and then only two or one recover, it means that there is a problem. So quality can sometimes affect the outcome. So this one is a major problem, and it is one of the indicators. Then system design, how the system is designed. We know systems are like part of the body, they work interconnectedly, so they work supporting one another. And if it is poorly designed, then it can lead to error, it can lead to low quality, and sometimes it can result to uh, health personnel burnout. And if there is a burnout, then the work cannot be done properly. So these are few indicators of health failures, and there are so many based on our contract, based on in our country. And what are the contributing factors? Contributing factors, as we discussed, one of them is cost and profit motive. There are some uh, health facilities or healthcare centers uh, which go higher because they want profit in giving care, and this one can lead to like higher pricing, focusing on treatment profit. And the other thing is workforce challenge. The factors that contribute to health failure are workforce challenge, shortage, like lack of training for real world needs, and sometimes the real people who are supposed to provide the health care or affordable one are burnout due to poor payment, poor management, poor leadership. Another one is payment models, like how how they are paid. One example is like, as currently we are in the UNICEF era, you can see the LS personnel going up to 7 months without salary. I'm sorry to say 7 months, but the way it is appearing now, it is look like it is going to 6 months, if not 5 months. That's what I'm saying. Then technology gap. The health system is always updating. Technology is being involved, like artificial intelligence and a new way of finding solution to the problem, like telemedics, the, uh, the, the the modern way of keeping health records, laboratories services, artificial intelligence used in the medicine. So if these things are not there, which are not there currently, then there is a sign that the health system is not progressing technologically. So now, as we progress, let's see also what are the solutions to this problem. The solution to these problems are transformation of the health. This is uh, uh, delivery and financing. Uh, Financing is what we are facing today. And then the other thing is focusing on prevention, because we should not rush to uh, to treatment when we know that we can prevent the sicknesses. For example, let's focus on family planning. If we are very sure, or preventive methods used in family planning, if we are to protect ourselves from sexual transmitted infection, then people should be encouraged to use both male and female condom. It is one of the best uh, barrier method. Instead of allowing someone to go for unprotected sex, then later on you will find them having gonorrhea, HIV, and AIDS, and other sexual transmitted infection like pelvic inflammatory disease in women, which can result in fertility at the same time. So it is better for us to prevent than to cure. So this is another solution. The other solution also to the health problems or failure is transparency and accountability. Uh, Here, transparency and accountability mean and main things should be done in transparent manner, in a right way, in a way that is visible to everyone. Accountability means if there is any indications of corruption, an indication of malpractice, an indication of mismanagement, then the person who is responsible with this thing should be held accountable. So this is one of the best solution that can be provided. Then the other one is care coordination, like better integrations of providers and data to manage complex chronic condition. As we continue, I thank you so much for having this time with me, and I hope with the time we will improve with the way we present our thing, and a lot of things are coming. Thank you for listening, all of you. You are welcome.